My name is Denise Mazzapica. I am one of the managers of nursing initiatives at the Institute for Nursing, and today we are going to talk about team steps for primary care teams. The Agency for Healthcare Research and Quality and the Department of Defense have collaborated for over a decade on multiple initiatives focused on reducing errors in medicine. Team Steps is one of these evidence-based initiatives. Team Steps stands for Team Strategies and Tools to Enhance Performance and Patient Safety. Because Team Steps is so adaptable, it can be tailored to meet the needs of any team in any setting. Team Steps has evolved from more than 40 years of research in the high-risk fields of aviation, the military, nuclear power, business, and industry. Healthcare is a high-risk, high-stakes environment in which poor performance can lead to serious consequences or death. In effective teams, mistakes are caught, addressed, and resolved before they compromise patient safety. Team Steps is an evidence-based framework to optimize team performance across the healthcare delivery system. This framework is composed of 4 teachable, learnable skills: leadership, situation monitoring, mutual support, and communication. The red arrows on the Team Steps framework depict the two-way dynamic between the 4 skills and the team-related outcomes. This graphic has been designed and has become associated with the conceptual model of teamwork in healthcare. Research has found that teamwork plays a critical role in providing quality healthcare, and that there are significant positive results when organizations implement teamwork initiatives. As Team Steps spreads across the many healthcare settings, the evidence base grows as well. Some of the current clinical outcomes of team training include a 50% reduction in weighted adverse outcome score, which describes the adverse event score per delivery, a 50% decrease in the severity index, which measures the average severity of each delivery with an adverse event, a reduced rate of adverse drug events, and improved medical reconciliation at patient admission. Research also cites outcomes of team training related to the way the team operates, such as the following: significant improvement in communication and supportive behavior, perceptions of teamwork increase significantly after team training, reductions in turnover rate, and an increase in employee satisfaction. This picture represents a moment in the life of the primary care office-based team. What the patient sees and what you as a team member see are significantly different. The general public experiences the primary care office from the perspective of one patient at a time, while primary care office-based team members know the reality of juggling numerous patients over a long period of time. Think about how this picture compares with the front desk picture in your office. Do you think your patients have any idea how chaotic the primary care office really is? And if so, how would they know? What would they hear? What would they see? If you could describe the primary care medical office in one word, what would it be? If your patients could describe that office in one word, what would it be? If someone asked you to explain what a typical day at the primary care medical office was like, what would you say? If patients described a typical visit to a primary care office, what would they say? On the surface, the office environment can and should appear orderly to patients, but to healthcare staff trying to attend to multiple tasks in a short time frame, it may seem chaotic. The analogy of a duck might help you to understand what you see versus what the patient sees. The part of the duck that you can see, the part above water, appears calm, but the part below the surface is chaotic with a lot of moving parts. Even though what the patient sees and what the team experiences are different, the actions of the primary team, healthcare team, have a profound impact on patient care. When teams fail to work well together, patients do know and experience firsthand the confusion, miscommunications, and uncoordinated care that lead to mistakes and negative impacts to patient outcomes, such as safety, satisfaction, or lack of engagement. There is a growing body of research that supports the value of teamwork in primary health care. This research indicates that teamwork results in better continuity of patient care, better access to care, and greater patient satisfaction. Where there is teamwork among healthcare providers, patients perceive that they are receiving higher quality healthcare. Each primary care office-based team is made up of team members from various categories: clinicians and clinical support staff, administrative team members, ancillary service members. Clinicians are those individuals such as the MDs, the DOs, physician's assistants, and nurse practitioners who are directly accountable for the medical services, consultation, and hands-on delivery of care to the patient. The clinical support staff consists of medical assistants, nurses, including RNs and LPNs, and others that provide assistance to the clinician in the delivery of medical services. The administrative team is made up of receptionists, office managers, billing associates, and those personnel that facilitate the day-to-day operations of the medical office. Finally, the ancillary and support staff is comprised of all services that facilitate patient care and may or may not be located where the patient receives their routine care. Ancillary services are primarily a service delivery team whose mission is to support the core team. In general, an ancillary services team functions independently, such as laboratory services, pharmacy services, and radiology. Now let's talk about your team. Who fills the roles we just talked about on the previous slide? How and where do these individuals interact and exchange information? Please take the next few minutes to answer the questions on the handout titled Module 1 and 2, Change Team Reflection. Your responses will be discussed in the weekly meeting you have with the rest of your change team. Teamwork can be hindered by various interpersonal or work-related obstacles that can arise in the work environment. Identifying these obstacles will help teams choose the effective tools and strategies capable to optimize teamwork and overcome these identified barriers to provide optimal care in the primary medical office setting. This slide provides examples of challenges faced by the primary care office-based team. Obstacles can include conflict among team members, lack of coordination, distractions, fatigue, roles not being clearly defined, miscommunication, and ineffective or incomplete sharing of information. Take a moment to think about some of the obstacles to effective care that you can identify in your office. Let's watch 4 different primary teams in action. Pay special attention to see if they are maximizing teamwork. Before we start the video, pull out your handout titled Module 1 and 2, Change Team Reflection. While watching the video, record any thoughts you may have in the Teamwork Video Reflection section of the handout. You will share your thoughts with the rest of the change team during your weekly meeting, but we will outline a few things to think about after the video.
Dr. Weiss.
Bill, hi, how are you?
I'm fine, Susan, and you?
I'm well, thanks. How's Maria?
Maria's great. She said to say hi.
Oh, she's so sweet. Tell her I said hello. So, why are you here?
Oh, I've had a bit of a problem and I was hoping you could help.
Okay, what's up?
I did something to my back playing golf. It's just killing me.
We're pretty busy today. Did you try to schedule an appointment?
That's the problem. I have an appointment scheduled for tomorrow afternoon, but I'm leaving the country tomorrow morning on business. It just slipped my mind. It's just killing me.
Say no more. We'll get you taken care of. Stephanie, can you start an intake sheet for Mr. Olson, please?
Of course, Dr. Weiss. Okay, here we are.
Thanks, Stephanie. I'll make sure to tell Ryan that Mr. Olson's in room 3 so he can go ahead and start his intake.
Okay.
Come along, Bill. Here we are. You can wait in here. Someone will be along with you shortly.
Thanks again for squeezing me in.
Sure thing. See you in a bit.
Excuse me. Sorry to interrupt. Do either of you know about patient Bill Olson in 3?
No. Who?
Bill Olson in exam room 3.
Oh, no, I have no idea.
No, huh? Well, any ideas of what should be done with Mr. Olson then?
I don't know. Maybe get his vitals?
Dr. Weiss, do you know anything about patient Bill Olson in exam room 3?
Oh, yeah. Sorry, Ryan. It's been a busy morning. I put Bill in exam room 3. Did you get his vitals yet?
No, I haven't. I was trying to figure out the situation with Mr. Olson, but no one seemed to know anything, so I didn't start yet.
Okay, let's get on that. Bill's appointment was originally scheduled for tomorrow, but he needs to be seen today, so we're squeezing him in right away. Get his vitals as soon as possible.
All right then.
Thank you.
Stephanie, what's going on with patient Olson in exam room 3?
His name is Bill.
I know his name. Why would you put him there without telling me?
I'm sorry, Ryan. Mr. Olson knows Dr. Weiss. He approached her directly. She said she'd let you know about it.
Fine, but I'm the MA. You have to communicate these things to me.
I know. I'm sorry. But I was completely bypassed. I just handed off the intake paperwork. I figured Dr. Weiss would take the reins and let you know, since it was her deal.
James and Schwartz, how may I help you? All right, feel better, Caroline. I'll pass it on. Excuse me, Dr. James?
Yes, Emily, what is it?
Carolyn just called in sick, and she's the triage nurse today.
Look, Emily, I don't have time for this today. Just call one of the nurses up to the front desk if you see a patient that needs immediate care. They'll take it from there.
But Dr. James, none of the other nurses scheduled today have any triage experience.
Emily, just call a nurse. Thank you.
Excuse me, Dr. James.
Yes, Sam, what is it?
Emily mentioned we have no triage nurse today, correct?
Yeah, that's correct. She'll call for one of you from the front desk if she sees a patient that needs immediate care.
All right, should we do a huddle or brief or something to explain what's going on to the rest of the staff?
No, that's okay. You just tell everybody, okay? Thanks, Sam.
Sure, okay, I'll try and tell everybody.
Sam, before anything else, can you quickly check to make sure that exam rooms 1 and 4 are ready? We're expecting an onslaught of flu patients today, and we have 3 appointments first thing.
Yeah, sure, I'll be right there. Yeah, we need to see you right away.
Miss Rainey, if you'll just have a seat in the waiting room.
We'll be with you in just a few minutes. Please have a seat in the waiting room.
All right, thank you. If you'll just wait a few minutes in the waiting room.
Thank you.
Emily, why are you calling a nurse up here to see almost every patient that comes in?
The triage nurse called in sick this morning. All the patients keep telling me that they're very sick. So I'm calling you guys to make sure they don't need immediate care.
Wow, okay. I really wish someone had shared that information with the rest of us.
I'm sorry, Kara. I told Dr. James.
It's not your fault. Just keep doing what you can, Emily, and we'll all try to come up and help you when we get a free moment.
Thanks.
Hello, Dr. Chase. How are you today?
I'm well, thanks. It's Bridget, right?
It is. So how's your first week here been?
So far, so good. Why, did you hear something?
Oh, no, not at all. Just being friendly.
Good. Well, I guess I'll be here a little while longer then.
Oh, by the way, Dr. Chase, Valerie is the nurse assigned to you today.
Oh yeah? I haven't worked with her yet.
It should go well. She's been here for 6 years, so she's very experienced and knows the ropes.
Good to know. Thanks, Bridget.
I'll see you later, Dr. Chase.
Valerie, where are Mr. Beal's lab results? I believe they're in his patient chart. They should be under the section for test results. I'm pretty sure you can access it through the toolbar. Bridget is responsible for making sure the labs are in the patient's charts, though.
If you nurses could just think ahead and focus your attention on what I need for each appointment, things will go a lot more smoothly around here.
I'm going to go ahead and check with Bridget again about the location of Mr. Beal's lab results. Oh.
You know, Doctor, Valerie's a very good nurse. She's been taking great care of me, and I trust her.
Thank you, Mr. Beal. I'll take that into consideration. Now, if we just had your labs. Did you two get this mystery figured out?
Here they are, Dr. Chase. Mr. Beal's test results are right here.
So they are. Here we go, Mr. Beal. Let me tell you a little bit about my charts.
Well, Valerie, you have a moment?
Sure, Mr. Beal. What can I help you with?
Boy, I think the way that new doctor spoke to you was just awful. Doesn't he know how to treat a lady?
No, unfortunately, I don't think he does.
Well, should I file a complaint?
No, I'll be fine. I've got thick skin.
Well, if there's anything I can do to help, you just let me know. Take care.
Thanks, Mr. Beal. Dr. Chase? Dr. Chase?
Valerie, what's up?
I've been at this office for 6 years, Dr. Chase. You've only been here for 1 week, yet you have the nerve to degrade me in front of a patient.
Valerie, please.
Just listen. I do not put up with nonsense in this office. I am too good at my job. Speak to me like that again, and there are going to be consequences.
Hello. Hi, I'm Roberta Aronson. I have a 10:30 appointment.
Oh, I'm sorry, your name again?
Mrs. Roberta Aronson.
Okay, well, it's 10:50 now, Mrs. Aronson, so you're a bit late. Let's see what we can do. That's a bad call. How are you feeling?
I'm really tired. I have no energy. It just took me too long to get ready this morning. It's hard for me to breathe.
Okay, yeah, I see you have a history of asthma, Mrs. Aronson.
Yeah, and it's really bad today.
Oh, I'm sorry about that. Let's see what we can do.
Thank you.
Hey, Sharon.
Hey, Peter, you got a second?
Sure, what's up?
Mrs. Aronson here is 20 minutes late for her appointment because she was tired this morning, and she says it's hard for her to breathe.
Well, all of our exam rooms are full right now. And have you seen the waiting room?
Of course. I signed everyone in. But I've seen her here before. She has a history of bad asthma, and she doesn't look so good. What should we do?
She seems to be breathing okay. See if you can reschedule her for later.
Just a moment, Ms. Aronson. I'll be right with you. Good morning, Valley Creek Health Center. Uh-huh. Oh, I understand, but we don't have any appointments left for today. Can you come in tomorrow at 3 or 3:30? Great. We'll see you tomorrow. Mrs. Aronson? I have a patient in distress at the front desk. I need help now.
What's happening here?
Mrs. Aronson says she was very tired and sick.
What's her medical condition?
She has a history of bad asthma. I told Peter she didn't look good, but he was very busy, so he asked me to reschedule her.
Now that you have watched the video, think about what went wrong and what could have been done to improve this situation. What did the team do wrong in this video? How could the situation have been handled better? Are these situations that you could potentially see happening in your office? The rest of the training will be spent exploring specific processes, tools, and strategies that have been proven effective for promoting highly reliable team outcomes by addressing the types of breakdowns that we have just viewed in the video. Specifically, we will explore how proficiency in each teamwork skill can affect performance in the primary care setting. Each of the strategies falls under one of the 4 critical and evidence-based teamwork skills around which Team Steps is designed: leadership, situation monitoring, mutual support, and communication.
My name is Mirta Rabinowitz, and I am one of the managers of Nursing Initiatives at the Institute for Nursing, and I will be talking to you about leadership, one of the modules in the Team Steps framework. Leadership is a process of motivating people to work together collaboratively to accomplish a task or tasks. We also like to say that leadership is the art of getting someone else to do something you want done because they want to do it. Now, leadership is a critical component of effective team performance and the first component of Team Steps that we will consider. Traditional definitions of leadership center on the concept of influence. For example, Peter Northouse refers to leadership as a process whereby an individual organizes and influences a group of individuals to achieve a common goal. Leaders influence teams' effectiveness by facilitating team actions, ensuring that the teams have the necessary resources for optimal performance, by ensuring that roles and tasks are understood by all the team members, by being knowledgeable of team members' skills and expertise in order to properly allocate tasks and material resources. Within the clinical team, the primary leadership role is generally held by the primary care provider. However, each clinical team member must know each other's role, including strengths and weaknesses in areas of subject matter expertise. In the operations team, a second leadership role may be that of administrative personnel, whose tasks include managing medical records, coordinating transfer of patient information, and interfacing with patients on non-medical issues. The traditional definitions of leadership have given rise to the concept of shared leadership. This is a partnership where 2 or more people or a team of people share power and join forces to move forward toward the accomplishment of a shared goal. Leaders impact team effectiveness not by handing down solutions, but by facilitating the team in the process of problem solving. So I'd like to talk to you about the characteristics of effective leadership. In the operations team, a second leadership role may be that of administrative personnel whose tasks include managing medical records, coordinating transfer of patient information, and interfacing with patients on non-medical issues. Traditional definitions of leadership have given rise to the concept of shared leadership. Now, this is a partnership where 2 or more teams of people share power and join forces to move toward the accomplishment of a shared goal. Leaders impact team effectiveness not by handing down solutions, but by facilitating team problem solving. Now, I'd like to talk a little bit about the characteristics of effective leadership, and the first one being role modeling. Role modeling and shaping teamwork through open sharing of information. The second one is that of constructive and timely feedback. Feedback is where learning occurs and is really critical as part of that team function. Facilitation of briefs, huddles, debriefs, and conflict resolution are also critical for the leader to be able to implement within her primary care setting. Now, I'd like to go on to talk about the 3 main characteristics that are part of the leadership roles. The first one is briefs. High-performing teams ensure that teams engage in 3 critical events, which are for the process of planning, problem solving, and debriefing for improvements. Briefs are held for planning purposes, huddles are used for problem solving, and debriefs are used for reflection and process improvement. We'll now explore each of these in greater detail, and as we go forward, keep in mind that although the team leader typically facilitates team events, any member of the team can request a brief, huddle, or debrief at any time as the need arises and is an example of shared leadership. The other thing I'd like to say about these 3 events is that as leaders, you need to be present at these events as they occur. Because while briefs are for planning, huddles are for problem solving, and briefs are for process improvement, you need to be present at these so that you can ensure that not only are they taking place, but that they are occurring as they should. An example, a brief should be short, 3 to 5 minutes, and include a certain content, but if you're not there to be able to observe that, you won't be able to evaluate that. So let's go on to the next page, and we'll go on to, the next slide, and we'll talk a little bit about the actual content of briefs. So the brief, the first step would be to form the team. They're sometimes referred to as team meetings, and they are held for planning purposes. The designated leader is responsible for organizing a 3 to 5 minute brief to discuss essential team information. Now, please note that I said 3 to 5 minutes. It is brief. If it goes on beyond 3 to 5 minutes, it's no longer a brief, and we're moving toward a meeting. So we want to make sure that everyone understands that a brief is brief. All members of the team are expected to attend the brief. And here's an example of the following information that should be discussed in that brief. First, an important component would be team membership and roles. Who is on the team? For example, today is Friday, and we have on our team these 3 clinicians, and you would have the 3 physicians or representation from the physicians. Who is your support staff? Who are the RNs? Do we have an LPN? Do we have a medical assistant? Who is our administrative personnel today? Who's our receptionist? Who is in billing? Who is the ancillary staff? Who is the lab that we're using today? Is it our usual lab? So my point being that you need to be able to establish who are the members of your team for that day. The second thing would be the clinical status of the team's patients. The current condition, diagnosis, plan, and status of each patient assigned to the team are reviewed. The next thing would be to discuss issues affecting team operations. For example, resources that you usually have, are they available? Successful teams measure their effectiveness in terms of goal achievement. Performance goals typically are set during this team event. If you'd like to, once your team is assembled, everyone is present, you want to be able to say, our main goal for today is, and that might be ensuring that you greet all the patients when they enter. Whatever it is, this is a team event, so your team, with the leader being the person that sets the tone and the climate, establishing what is the goal for the day. And they should be both long and short-term goals. The next one would be the briefing checklist. Now, this is an example of how you can use the standardized checklist, or you can create your own checklist. Now, the briefing checklist is similar to a pre-flight checklist used in aviation. Team leaders should cover the items on this checklist. An example in aviation is that this pre-flight briefing checklist provides an ideal forum for building a team dynamic that allows everyone to work together when carrying out routine tasks and when tackling unexpected problems. Now, in this brief checklist, you want to be able to just, as you look at it, you'll see you want to ask, who's on my team today? We talked about that a minute ago. Are all members here clear about the goals, and do they understand their role and their responsibility? How many staff members do we have? What is the workload of each staff member? Is the workload distributed evenly, equitably? Are there any persons here that feel that their workload is not appropriate? Do we have the available resources that we need? Are there any resources that we anticipate we're going to need today? So you understand where we're going with this. The goal is to bring that team together, get everyone to know who is here today, and from that be able to say, do we all understand our goals, and do we all understand our roles and responsibilities? That really is the gist of what a briefing checklist and a morning brief is. So let's now go into the next slide and talk about a huddle. A huddle is a quick, reactive, touch-based meeting to help the team members regain situational awareness, which is just being on the same page and understanding what's going on around them. It is used to reinforce the plans that are already in place for treating patients, as well as to assess the need to revise those plans. It quickly allows team members to discuss critical issues and emerging events, anticipate outcomes, and decide what can be done, what could be done differently. Here you could also assign resources. If someone decides that they are unable to complete their assignment, or that one of their patients is having a higher acuity than they planned, they may decide they want to call a huddle and ask for assistance. Here you could also express concerns of what is going on in the office. Anything can be brought up in a huddle. And remember, as I said earlier, anybody on the team can call a huddle or a brief. So this is a way that we can help the team to be able to stay together and to be able to handle any unexpected emergencies that may come up in the day. Now, utilize the Change Team Reflection Worksheet to list a few possible examples of when you could use this huddle, and then we will be discussing that. Okay, now let's talk a little bit about a debrief. And a debrief is an opportunity for process improvement. The debrief is short, informal information exchange used as a process improvement tool. It occurs after an event or shift and is designed to improve teamwork skills. Team actions and outcomes are discussed against the established plan. We had a plan. Did it work? Did we achieve the goals that we had in mind? Debriefs are most effective when conducted in an environment where all actions are viewed as learning opportunities and never, ever punitive. Debriefs can include any of the following: accurate recounting and documentation of key events, analysis of what occurred, what worked, what didn't work, reflection of why, and implications for practice. It will include a discussion of lessons learned and how the team will alter the plan the next time. And it's also an opportunity for establishment of a method to formally change the existing plan to incorporate lessons learned. So if we have a debrief and we look at what occurred, what we did well, what we did differently, and we found that it really worked well, then we may decide that this is the way we want to do it going forward, and ensure that every person on our team understands that, and that will be the practice going forward. Debrief should be the subject of a team event, typically initiated and facilitated by the team leader. Debriefs are most useful when they relate to a specific team goal or address particular issues related to recent actions of the team. Debriefs also maintain effectiveness by not assigning blame or failure to an individual. Remember, a debrief is an opportunity for process improvement. If you take a look at this slide, you will see that there is also a debriefing checklist available, and it will guide the team leader in conducting that debrief. So the first topic would be, was the communication clear today? Did we have situational awareness? Was it maintained? What was the workload distribution? Now, this would occur at the end of the day. You would bring the team together and go over. We just want to debrief. How did today go? Did we ask or offer assistance? Were there any errors made or avoided? What went well today? What should change? Or what can we improve? It's a great opportunity to then just bring the team back together and let everyone feel like a team that started the morning with a brief. They went through their day, they huddled as necessary, and then they came together at the end of the day and they debriefed to see, how did this work? And if it didn't, how can we improve it? So this is an opportunity to get the team to start to really feel cohesive and have the opportunity to give feedback, learn without there being any. So we had originally watched the poor team leadership slide. So now let's take time to watch them demonstrate proper leadership. Before we start the film, please pull out your handout titled Module 1 and 2, Change Team Reflection. While watching the video, record any thoughts you may have in the Teamwork Video Reflection section of the handout. As mentioned before, you will share your thoughts with the rest of the Change team during your weekly meeting, but we will outline a few things to think about after the video.
James and Schwartz, how may I help you? All right, feel better, Carolyn. I'll pass it on. Excuse me, Dr. James?
Yes, what is it, Emily?
Carolyn just called in sick, and she's the triage nurse today.
Okay, do me a favor. Gather up the staff. We will need to do a quick huddle at the front desk before the day begins.
Got it, right away.
Okay, perfect. I'll be there in 10.
Okay.
We're swamped today. It's flu season. We don't have time to stand around.
I know, but Dr. James called this huddle. He should be here any minute.
Good morning, everyone. I need to tell you that Carolyn called in sick and she was assigned to triage. So we have 3 providers here today, so we'll take turns covering for Carolyn. During your triage shift, you'll see your scheduled patients every 30 minutes instead of every 15. Any patient you can't see will be passed off to another provider during your triage shift. That way we can ensure that anyone who needs immediate care is appropriately seen. Any questions? No? Okay. Be sure, everyone, to explain to our patients that the wait may be a little longer today, but we're doing the best we can, all right? Thanks, everyone. Let's have a productive day. All right, sir. If you'll just have a seat right over there, we will get to you as soon as we can, all right? Thank you.
We're going to see you right away, so why don't you come on back in? It's that first floor there on the right.
All right, sir. We'll get with you as soon as we can, okay? You can have a seat back in the waiting room for us. Thank you.
Excuse me, everyone. Can we have a quick debrief about today's events? Kelly, Sam, is that everyone? Yeah. All right, good. So, what do we think about how we handled our workflow today without a triage nurse?
I'll start. When I first heard the news this morning, I was a bit wary, but from the moment you called the huddle, I felt fine.
It was busy, and everyone was alert and acted as a unit. We seemed to communicate well and pulled it off just fine. I'd say it worked for us.
I'd agree with Dr. Schwartz. I mean, although this isn't something that I'd commit to on a daily basis, I think it would work as a last resort. I mean, we managed to come together as a team and support each other, and that led to a successful day.
I think it went well. Thanks for great leadership today, Dr. James. It helped us all ease into the situation confidently. Everyone appeared to be aware of what was happening and adjusted to make sure the patient's needs were met.
Don't forget Emily. She followed up with Dr. James immediately.
Thanks, Kelly. So if a triage nurse does call in sick again, should this be the plan of action?
That's a good question. From everything I've gathered today, this does seem to be a completely viable solution. So if everybody is comfortable with it, I think we should adopt this as the new default. Everybody on board?
I might just suggest that we have a provider or a triage nurse on call for this situation specifically. I feel that our patients shouldn't be passed around unless completely necessary.
Point taken, Miles. I'll look at the schedule, see what we can do about getting somebody on call. Anything else? All right. Well, excellent work today, folks. Let's close this place down.
Okay, now that you've watched the video, let's discuss it. Think about how this video compares to the first scenario in the first video. What went better this time? How did the team leader improve the situation? In particular, how was leadership demonstrated in this video? Was the strategy effective? Why was it effective or not effective? Did you see any other opportunities for leadership to be demonstrated in this video? Have you encountered situations similar to this? Take a few minutes to think about your own office teams or teams in terms of leadership and whether you have encountered leadership problems. The what, not the who. Make notes of your thoughts to discuss. Let's look at this front office scenario. Your patient is an elderly man who just had cataract surgery and is not able to drive. He was taken to the clinic by his son for a follow-up on his blood pressure and diabetes. While he was in the examination room, his son was called away on an emergency. When the patient finished his appointment and found that his son was not waiting for him, he was very upset. The front desk administrative personnel realized that the patient had no way to get home and called a quick huddle with the nurse and the billing specialist. Together, they decided to arrange for a taxi to transport the patient to his home. The front desk administrator then called the patient after he arrived home to make sure all was well. The outcome of this scenario is only one of many possible outcomes. Can you think of any other way the situation could have been resolved? As you can see from this scenario, the strategies taught in Team Steps apply to everyone in the primary care office. Leadership is the responsibility of everyone on the team. This slide that you're looking at now is the summary slide of each one of the modules, and it essentially summarizes what we have covered. We started with barriers, and you can see those listed in the left column: hierarchical culture, lack of resources, information, ineffective communication or conflict. And then in the center, what are the tools and strategies available to you? In this leadership module, we talked about the brief, which is a planning session, the huddle, which is used to problem solve, and the debrief, which is used for performance improvement. And the outcomes of employing these tools in your office setting will be that your outcomes are going to improve. You will have your team having a shared mental model, everyone being on the same page. The ability to share information and to feel part of the team and to have your voice heard increases the adaptability of your team to changes in the situation. The team orientation will also help to build mutual trust and respect amongst your team members.